The functions of the urinary system are to filtrate fluids in the body, to store urine, and to excrete that urine. You know that just like the liver has function of filtration and neutralizing toxicity, the kidneys play a role in filtering out excesses of bloodborne products. And so blood passes through the kidneys. There's filtration of too much of whatever's there, and for regulation of body fluids. So the excretion part happens from the urinary bladder through the urethra for urine to be expelled. The storage happens in the urinary bladder, and the filtration happens in the kidneys, and through the ureters from bilateral kidneys, urine is deposited into the urinary bladder. Infection of the lower urinary tract occurs. Actually, the contents of the bladder are sterile. The urethra is sterile unless a bacteria moves into that urethra, and causes of urethritis or cystitis. Urethritis obviously is inflammation of the urethra. Cystitis is inflammation of the actual bladder. But here are causes for infection of the lower portion of the urinary system, called a UTI. Inactivity. Those of you who are going into physical therapy, you know that the role of the physical therapist in the hospital with patients who are bed-bound is to get them non-bed-bound as soon as possible. Post-surgical, post-trauma, need to get them up and moving because they're very, very vulnerable to cystitis. Those who tend to retain urine in senescent individuals, they can have a tendency to not have the urge to urinate, and they can retain urine, and that becomes an incubator for bacteria. Obstructions to the normal urine flow from the bladder through the urethra as a result of prostate or other obstruction, maybe neoplastic changes where the urethra is stenosed. Prostatic hyperplasia, where the prostate becomes enlarged and the urethra actually passes through the prostate, and if the prostate is enlarged, it may serve as a stenosing influence. Certainly constipation, bacterial infection, and pregnancy. Signs and symptoms of a UTI are enuresis. That means loss of control of the bladder. Could be bedwetting, or it could be urge incontinence. When an infection occurs, there's the frequency and urgency of urinating are really increased. When a person needs to go, they need to go now, and that's a sign of urinary tract infection. Dysuria is painful. Pyuria is urine that has pus in it. This will be a foul-smelling urine. And dyspareunia is pain on coitus, or having sexual relations. Prevention of UTI includes copious ingestion of water. You see in the PowerPoint presentation that what the quantity of recommended intake per day. Cranberry juice, fruit and vegetables, washing before intercourse, urinating after intercourse, in females wiping after urinating from front to back, and avoiding treated materials, toilet papers or soaps or powders in the vagina. Prevention of UTI includes avoiding excess ingestion of these foods or drinks. So not going to read all those to you, but you might find that interesting in terms of what you're doing in terms of ingestion of foods. The inflammation of the bladder could lead to pain, frequency, and urgency of urination, and it could result in hematuria. It's never a good thing to see blood in the urine. It can indicate a number of different pathologies, and one of those is inflammation of the bladder proper. That could indicate that there's cancer. It could indicate that there are other mitigating circumstances of infection, and if infection stays in place for a long period of time, it can change the lining of the bladder, and that can be prodromal to cancer. Upper urinary tract infections typically result from bacteria, vesicoureteral reflux, and that would be where there's an infection in the lower urinary tract and it ascends through the ureters. If that gets into the kidney, there'll be kidney injury, and you can't live without kidneys. People who lose function of their kidneys have to go on dialysis. This is a real threat to quality of life and may influence mortality. Glycosuria, people who have way high levels of sugar, these are uncontrolled diabetics, and high levels of bacteria loves sugar, and so if blood sugar is very high, then infection can occur. And signs and symptoms we've listed for you previously in terms of pyuria, bacteriuria, hematuria, low back pain. Treatment for that is antibiotics. And then the scourge of middle-aged people, particularly men, are the formation of stones. Because filtration is what's occurring here, if there's increased numbers of salts that come into the kidney and the water is removed, then there's a formation of these calculi, and these tend to accumulate more salts and get enlarged. And there's different theories for the formation of lithiases. A nephrolithiasis is the formation of what euphemistically is called a kidney stone, and these are common sites for where the stones would congregate. Here's a sonogram of an obstruction. You get obstruction, there's really increased amounts of pain. The dietary adjustment for this is bran reduces, in other words, fiber in the diet reduces the formation. Chocolate, spinach, and peanuts can increase the formation of lithiases. Like in the cholelithiases, if a lithiasis becomes so large that it can't be passed, then lithotripsy is utilized to break down the size of the stone. And here's a schematic of how that happens. As sound waves come, it focuses the vibratory impact on that stone, and the hope is to reduce the size of it so it can be passed. Colic. You've heard of a colicky baby. Well, urine passes from the kidneys through the ureter through this symmetrical or rhythmic contraction of smooth muscle, and so urine is milked down. If for whatever reason there's an obstruction or a spasm here, these contractions hit down on each other and there can be a spasm, and it's very, very uncomfortable and unproductive. This can lead to pain patterns in the back. Renal expression of pain could be in that position. So, yeah. Kidney failure results from permanent loss of nephrons. The etiology is hypertension. We dealt with hypertension specific to the liver as a result of cirrhosis. It can be from atherosclerosis is a possibility. Could be from obstruction. Could be that people that come from your lineage have this, and so it's inherited. Diabetes can be a precursor to kidney failures, in addition to the retinas of the eye and the kidneys and peripheral vascular circulation. These are end-stage diabetes circumstances where tissues are lost and can't live without kidneys, and people who have diabetes are really vulnerable. And then certainly the deleterious effect of systemic sclerosis, erythematosus, can result in kidney damage. We've talked to you before about the threat of acetaminophen, you know it as Tylenol, and NSAIDs. And I'd like you to really lock into the guidelines for how many total pills that one could have. Acetaminophen, we shouldn't have more than 1 pill a day and no more than 1,000 in a lifetime. For NSAIDs, no more than 5,000 in a lifetime. Otherwise, the kidneys and the liver, where there's filtration, are very, very vulnerable. Here's the prevalence or the epidemiology of kidney disease. I'll let you consume that to help you realize that like there's not enough livers, there are not quite enough kidneys. More livers are needed than kidneys, but this is the deal. I'll let you appreciate the content in this slide. I'm not going to read it to you, but progression of disease to the point where kidney failure can lead to complete loss of the kidney. Some of the signs and symptoms of chronic renal failure include extremes of potassium and not enough calcium, extremes of potassium, metabolic acidosis because of the decreasing pH, urticaria are hives that can be manifested. Restless leg syndrome is presented to you on, if you'll go to this on this link in the PowerPoint, you'll see a YouTube of a person who's expressing restless legs. So they can't control their legs, they can't sleep because their legs are just moving. This is a symptom of chronic renal failure. Pruritus is itchiness, hiccups, skin and breath smell like urine, and anemia. In other words, urine is not being successfully or effectively taken through the upper urinary tract to the lower urinary tract, and the person is permeated by urine, buildup of urine. Neurogenic bladder. This can be a result of iatrogenic causes where the bladder's not functioning properly, and it could be from paralysis or from medications, and the person is retaining urine or incontinent or very frequent urination. The person may need to be catheterized. A person's a paraplegic or a quadriplegic. They don't have normal sensation. They don't know when to urinate, and so this has to be done mechanically on a systematic basis. So, okay, You take care.